Thank you very much for that. It's a very moving presentation to think about, especially that example that you gave. So next I'm going to introduce Kimi Watkins-Tartt, who will provide what's described as a local perspective on this topic, but as I learned in hearing from her on a phone call, Alameda County gives a new meaning to local. It's 14 cities in there or something like that. So she brings over 25 years of experience working within the local public health community. So please welcome Kimi.
Thank you for having me this afternoon. Before I get started, I want to really acknowledge all of the people who made this work possible. Let me just make sure I'm going in the right direction here. Yes, okay. Oh. Everything that I'm going to talk about today really is the result of not only our public health department staff, but wonderful community-based organizations throughout our community and the residents. It's because of the residents that we do the work that we do, and without them, most of these projects would not have been possible. Health equity means achieving the highest level of health for everyone. Health equity entails focused societal efforts to address avoidable inequalities by equalizing the conditions for health for all groups, especially those who have experienced socioeconomic disadvantage or historical injustices such as racism. This is Healthy People 2020. In Alameda County Public Health Department, we envision a county where everyone, no matter where you live, how much money you make, the color of your skin, leads a healthy, fulfilling, and productive life. Unfortunately, in our county, that is not the case, and the projects that I'm going to talk about really works to address that. To achieve our vision, our department has approached our equity work by focusing on policy and systems change, institutional change, which is both inside of our health department as well as other institutions, and most importantly, community collaborations and partnerships that include residents. This approach is both supported by and informs our department's programs, our services, and data and research. For today, I'm going to highlight 3 projects of our department. These projects incorporate aspects of this approach. One of the key ingredients of our approach, and is reflected in the projects, is the community partnerships and the resident engagement. The first project that I'll talk about is a partnership that we engaged in with the Alameda County Community Development Agency, or the Planning Department. We came together to develop the Ashland and Cherryland Community Health and Wellness element, which is an element of the Alameda County General Plan. The health and wellness element is based on the principles of equity, accountability, collaboration, diverse resident partnership, and the development of local assets and resources that support the community's vision of health and wellness. The goals of the plan were to influence decisions regarding physical, social, and economic resources. It was intentional that this was not just a land use plan, though land use is integral in the plan. What's unique about this process was the robust community engagement that ensured that the residents, most often marginalized and left out of these planning processes, were front and center in this effort. There were several ways that we went about engaging residents in the Ashland-Cherryland community, and some of those include a project website, very basic, but very important, so that the residents of the community could track the progress of the planning process. They could see what was going on and make sure that things were unfolding the way that they had thought they would unfold. We also established a wellness advisory committee, which was established based on community-based organizations in the area, local businesses, residents, as well as other stakeholders. Their charge was to hold us accountable, essentially, and to make sure that the residents' voices were not lost. We also held several workshops for residents. It was important that we provide education and information in a comfortable setting so that the residents could authentically participate. In addition, we showcase the progress of the work in different community events like street fairs, health fairs, other types of community events, so that people who couldn't participate in some of the more formal structures were able to see what we were doing. We also conducted a community-wide survey, and this was done by sending out a survey to every household in the area. Again, a way to hear from people who were not able to participate in the other venues. Last, we also conducted focus groups so that we could get more detailed information on what the residents wanted and how they wanted their community to look and feel. The plan was eventually approved by the Board of Supervisors in December of 2015, and the sections include sections you would ordinarily see in the plan such as this: health and social services, public safety and social environment, land use and housing, economic opportunity, active and safe transportation, healthy food access, parks and community facilities, and sustainability and environmental health. One of the primary strengths of this effort was the deep engagement of the residents of Ashland Cherryland and the community partners who now have collective ownership of the values and the intentions of this policy. And while we consider this to be a success, there were certainly challenges and lessons learned. First, if we were to do this again, and we hope to do this again in the other 13 cities in Alameda County, that we would ensure that the process doesn't exclusively depend upon having a champion inside of the organizations that we're working with. As we all know, as organizations change, people move on. If that is how this is getting done, then some of the work can stall or just come to a halt altogether. Second, we would have a more formal structure in order to ensure that the policy document is consistently used by the planning department in order to maintain the vision of the community. And so we're working on putting that structure in place now. Another effort that is still in progress is a partnership with East Oakland Building Healthy Communities, which is funded by the California Endowment, to put a health equity lens into the City of Oakland Planning Department's everyday review of new projects and decision making. The process to create what we're calling Healthy Development Guidelines was led by a team from East Oakland Building Healthy Communities, and that team included Causa Justa Just Cause, Communities for a Better Environment, East Bay Housing Organizations, and the Hope Collaborative. Also part of the team was the Alameda County Public Health Department and the City of Oakland's Planning and Building Department with the assistance of Ramey & Associates and Change Lab Solutions. The Healthy Development Guidelines are a planning tool to incorporate policy and administrative changes that promote health equity and resident engagement into citywide planning processes. It's intended to both benefit the health of new and existing residents, especially those who face the greatest exposures of cumulative health impacts or the effects of multiple environmental exposures. These guidelines and standards are intended to be used by the planning department for their review of projects, by developers as they plan projects, as well as for residents and the general public to better understand the city's requirements and expectations for health equity. Here, in addition to creating a set of development standards and guidelines that city planners and developers could use as a benchmark to support healthy and equitable development, we also wanted to model for our colleagues a process of inclusion and robust community engagement. East Oakland Building Healthy Communities lead organizations worked very diligently with resident leaders to convene an initial half-year process to develop the vision and priorities of the tool, and then led follow-up meetings and events to share the updates, ground truth, the various drafts, and get resident feedback. This process also created opportunities to engage in ongoing activities like this picture, which is from an educational forum that we all held on local and state ballot initiatives last November. And what it says up here from one of the residents of East Oakland Building Healthy Communities, this has been an opportunity to be true partners. She goes on to say, I can see how these guidelines could have been made without residents at all. We have partnered because we have something to say. We have a lens that should always be there. We know how development will affect the people who live here. The role of the Public Health Department in this effort was to convene a technical advisory group that included community-based organizations, the City of Oakland, public health staff, developers, and consultants that met after the resident meetings to take the resident input and draft policy goals and develop standards. The city planners provided helpful feedback about what's already on the books and technical details to make sure that the standards we created were implementable. It was a long and iterative process, and naturally, issues of capacity and trust came up very quickly. It was very challenging for us to build our own capacity to make sure that we could get residents up to speed for the authentic involvement and engagement, as well as build our own knowledge so that we could get the perspectives of everyone at the table and we could develop the expertise to create something new. Trust and accountability are huge. Whenever there are partnerships between residents, community-based organizations, some grassroots base-building organizations, and government, there will be issues of trust that come up very quickly in that process. And it was important around trust and accountability that we not lose the vision of the residents in our process of trying to create the standards. We wanted to make sure that their voice was heard, and we had to create opportunities for the transparency so that they could see that their vision was not being lost. The guidelines include some of the same sections that I described in the Ashland-Cherryland wellness element. There are, however, in the guidelines language about displacement and ensuring that the residents that live in Oakland are not accidentally pushed out when development occurs. And that kind of language is new, it's different, and it doesn't actually exist in the Ashland-Cherryland wellness element. We're in the process of refining a policy that we will bring forward to City Council soon. We consider the guidelines to be an interim step, and we're hoping that we will be able to participate in a more formal process of including objectives and health equity language into the city's general plan at a future date. Another way that our department has worked to change the physical and social conditions of low-income neighborhoods is by improving the food retail environment. We had done projects like this in the past, but we approached this one slightly differently. The vision of this healthy food retail project is to develop a model for achieving and sustaining healthy retail environments in neighborhoods most burdened by chronic disease. The three components of our project were to pilot demonstration projects in both East and West Oakland, to research local policy options to institutionalize the promising practices, and to develop an approach and identify resources for a countywide effort eventually. Two community-based organizations, the Hope Collaborative and Mandela Marketplace, were engaged to implement the project along with our public health staff. Each of these organizations has a unique approach to the work, but what's common between both of them is the engagement of the residents in the surrounding neighborhoods that they're serving. Both organizations work directly with the residents that surround the stores to help inform the approach that they're going to take, as well as implement the work in the stores. Specifically, Hope Collaborative and Mandela Marketplace work with stores to increase the availability of healthy foods in general in the store, reduce the shelf space allotted to unhealthy products such as tobacco and alcohol, which are often aimed at young people, reduce advertising for unhealthy products, and increase the visibility of the choices that are available in the store. This is two pictures of a store that we're working with in East Oakland. And the contractors that we work with really start by looking at the exterior and the feel of the store. And in this particular situation, a lot of work was needed to really improve what the store looked like on the outside. Another strategy used was to rearrange the inventory to promote healthy products and de-emphasize unhealthy ones. On the left, you have the shelves that were disorganized, they were dusty, mixed categories and alcohol in the aisles. On the right, what you see there are now departments and categories that were created, and alcohol was moved to the back of the store. Another similar picture, disorganized, difficult to find groceries or healthy products, underutilized space. Here you have the Hope Collaborative members engaging the store owner and the staff to reorganize the store shelves. On the right side, you also have young people, youth, and volunteers who are helping to reorganize the foods by placing healthier foods at eye level in front of the store. And this is one of the stores after. It's also important to implement marketing and promotional activities, as well as in-store trainings in safe food handling and how to inventory store product. Some of the successes of this have been a deep relationship with store owners, which built the store owner investment and participation. Marketing and branding stores so customers associated them with healthy products, conveying health messages to customers through demonstrations or marketing materials, using Alameda County Public Health Department resources to garner additional funding to support store changes. Some of the challenges have been economic pressures on the store owners who needed to replace lost profit from unhealthy products, strong marketing of unhealthy products by the distributors of alcohol and tobacco, pre-existing negative perceptions of the stores from the neighborhood residents and law enforcement, as well as the high costs of making big improvements in stores. What we've learned is that asking store owners for layout changes is possible, but easier after there's a relationship. Once tobacco and alcohol ads were reduced, customers actually started to look at the store differently and see them as places to purchase healthy food. Oakland's neighborhoods, like many around the country, are changing. Demographics are changing rapidly. And so we're in the process of working with the stores to make sure that while the demand for healthier products and prepared food is increasing, along with the ability to pay a higher price, that's balanced against the needs of the people who already live there and have been living there for decades. Offering a variety of store interventions contributed to the success of this model. We know that we can make changes. We know that when we make changes in the environments that people live in, that their health will improve. The challenge is to make sure that the people that we so often read about in the data are at the center of the conversation. They have to drive it, they have to shape it, and they have to own it. Thank you.